How we started this collaboration. Of course, it was actually ASCO 6 years ago, probably, that I was presenting a trial in lung cancer. It was actually a phase 2 trial in lung cancer in combination with immunotherapy, atezolizumab, that we were done, and it was actually 30 patients. So I was presenting the work. It was a poster, and of course, Lan came because she was surveying all the posters, saw a trial that was done in lung cancer. Of course, you know, Lan was very interested in lung cancer, having to potentially combine plinabulin in that group of patients. So she approached me, interested in terms of potentially doing a trial with us in terms of MD Anderson because of our success of enrolling patients in lung cancer patients. So she told me a little bit about the drug. I didn't know much about it at all. But so we had actually a separate meeting during that meeting actually to talk about a little more detail about just the, you know, what the basic mechanisms is and what it is, just the, you know, basic idea and basic data that's actually on it. And so I got interested, and so I said, sure, and I want to find out more about it. So it was actually landed very nicely. Of course, has already been collaborating and doing some very basic science work along with other scientists that BeyondSpring has been funding. So we actually had a meeting. This is now I think 5.5 years ago or so. We actually had a meeting in San Diego at a very nice resort called Estancia, and we remember distinctively that we had that whole day meeting together at a round table and just talk about science. Talk about the basic mechanisms, going through all the basic data that BeyondSpring has been supporting for at least a couple of years, and talk about some of the paper that's actually some of the work that's not published. And but then I was intrigued by the science, of course, by what the molecule is doing and what the potential mechanism they have in potentially immune stimulation. But also I present a talk about the unmet needs in lung cancer. And it's there where we just start discussing what is the best way to potentially combine plinabulin with immunotherapy. And we felt that we need a cytotoxic agent, something that can stimulate antigen presentation. And that's where then you have the immune priming with plinabulin to prime the dendritic cells to then potentially activate the systemic immune response. So chemotherapy is certainly one particular approach. Dr. Zepelius was there. Of course, he was the basic scientist, did a lot of the basic science work. He felt that, well, chemotherapy is actually a good antigen, potentially activator and antigen generator. But however, it does cause a systemic effect, right? There's potential toxicity in the combination. He felt that potentially we talked about maybe localized radiation might be the best combination, because localized radiation is safe, it's something that's done commonly, it's one of the standard of care. And in lung cancer, it's something we do very commonly, and that's where the idea was spawned, is that we can do localized radiation in combination with plinabulin and also immunotherapy, this triple combination idea. And we said, well, and that's where we actually had a nice sit-down agreement, had a nice dinner afterwards, and saying this is something we need to do. And actually, I went to Dr. Zepelius' lab, and actually in Basel, Switzerland, and actually got to see what he did and some of the data that he has acquired. And actually, eventually, we collaborated and actually got the cell lines that we did to initiate some of the preclinical work and to really come up with a rationale to do the phase 1 trial. Yeah.